Welcome to another episode of the Do Big podcast, where we dive into the transformative world of technology and healthcare. Today, we're focusing on the healthcare market, which was valued at $110 billion in 2016 and is projected to skyrocket to 638 billion US dollars by next year. As of 2024, the healthcare sector is one of India's largest employers, engaging 7.5 million people and more. This growth is driven by a critical demand for healthcare professionals, a demand that is expected to double by 2030, both nationally and globally. This comes at a time when India faces a stark shortage of healthcare workers, with just 1.7 nurses per 1,000 people and a doctor to patient ratio of 1 is to 1,500. Amidst these challenges, we have companies like Prodoc stepping up to revolutionize patient care through data driven solutions. Prodoc harnesses AI to personalize healthcare, making it accessible directly through patients' phones in their preferred languages. This no app platform is not just enhancing convenience, but is fundamentally transforming how medical care is delivered across diverse populations. Join us as we discuss with Raghuvamshi Thakur, the co-founder and CEO of Prodoc, how their innovations are setting the stage for a new era in healthcare, aiming to make quality healthcare reachable for every Indian. Let's explore how technology and foresight are paving the way for better health outcomes in one of the world's most dynamic healthcare landscapes, India. Raghu, welcome to the Do Big podcast. It's absolutely our pleasure to have you here today.
Thank you, Sheetal. Likewise.
So, Raghu, I'm not going to waste any time. I'm going to just jump into the conversation with you. And what I want to really understand is, we've talked about the fact that there is challenges in Indian healthcare, but at the same time, there's so much happening as far as health tech is concerned and how digital is transforming healthcare. Want to understand, how do you think digital transformation is impacting healthcare delivery in India today?
So it's very interesting that we talk about digital health transformation. But at the same time, one of the primary beneficiary of that digital transformation, which is patient, is still pretty much residing in the same place where he was, let's say, a decade back. Right? This is also not to say that we haven't made advancement. Right? If you really see, today, the reason why our doctors mostly recommend tests before he jumps into let's say, a diagnosis is primarily because the medical tests they've become so commoditized, and the price point is so low that almost everybody can afford them right now, right? The doctor doesn't have to, let's say, build a probability without having a data, right? So it's very data-driven decision making that doctors are doing today. Lot of AI already is impacting the radiology per se, right? So there's a lot of work that is going on primarily because of the AI ML advancements that have happened. If you really see inside the OT or inside the hospital, a lot of digitization that has happened. Again, from HMS to HIS to a lot of information that is exchanged. Right? And a lot of this digital transformation also rightly being driven by government agencies. Right? So you must have heard of Abha Stack. You must have heard about ABDM that is going on, right? Yeah. So lot of concrete effort is being made by the government to actually enable digitization to the last mile, right? This is not about digitization at the metros or at the tier 1 level. This is going to tier 2 and tier 3s right now, right? That's the impact that government is trying to have. And I think the ABA stack or the ABDM stack will have the same impact what UPI had on, right? This is going to be a big transformation. It's not going to be easy. It's going to be difficult. We already see there are a lot of challenges there, but a lot of this transformation will happen over time, and you'll see a lot of digitization happening. Not only does it, the ABDM not only triggers digitization, it also enables standardization of information and democratization of that information across healthcare entities. Right. So this is a fantastic change that is happening. The reason why I said nothing has changed for patient is because you and me, when we go to an hospital, we get a bunch of documents which we don't understand. Right. The only thing that we walk out of, which actually makes sense to us, is the prescription. Right. Um, and honestly, that has not changed. Right. That continues to be the same. Right. From Prodoc point of view, our journey was very focused on patient, and we said, you know what, we need to empower this patient with enough information that when he goes back, he does not just know the medicine that he has to take. Even if he has, let's say, related questions, he should be able to answer that. He should be right. Now, this doesn't sound like a big deal when you're going for, let's say, your regular checkup or small issue that you might have, right? But when you actually look this in terms of cancer care or maternity or IVF or ortho related cases where the care journey itself is very long, I personally have experienced this quite a bit that every time we would come back home, there will always be a question that we would want to be answered. But now, because we're home and we don't have access to a doctor, we wouldn't be able to do that. Right? And we're primarily trying to fill that gap. Right? So, what we're really trying to do from a Prodoc point of view is build that digital care assistant that is available to you without even downloading an app. Right? And that's the incentive. Yeah.
So it's quite interesting because you're talking about patient care and it's about the family which is coming in and the patient who's coming in. Just, I'm sure when you started this off, one is personal experience and you do talk about that. But what are those 2 or 3 critical areas where patients even today feel like I'm at a complete loss? I don't know what I'm supposed to do, right?
Very good question, right? So if you take statistics, and I like to harp upon this one part, right? One, there's two very interesting statistics that we need to understand how the healthcare has been evolving in India, right? 7 out of 10 in India today lack health literacy, right? What that means is that if you have a problem, and let's say you have a specific problem in specific body part, the patient is unable to diagnose or unable to identify the right doctor that he should be going to, right? So he depends on a general practitioner or somebody to make that decision for him to actually go to the right person.
Yeah.
And then the second statistics, which is also very interesting, is that way beyond the WHO standards, India has one doctor for every 1500 people population, right? Which means even if the doctor wanted to spend that effort to enable the patient with that health literacy, he probably does not have that kind of bandwidth today. Just to circle back now to the question that you're asking, right? The 2, 3 things that patients, and one very striking thing is that patients and doctors understand this well, while the patient do not. And I'll give you a very good example there, right? That no two patients have the same journey. We are two individuals, and even though we might be going through the exact same problem, we still may not be necessarily going to or will have the same remedial actions that are taken for us, right? Good example is two women, if they're going through a maternity cycle and they're in exact same trimester and maybe even matching dates, they'll still be experiencing a completely different experience in terms of, right?
Correct.
While we understand that part, lot of us as patients, we always tend to think and compare ourselves with a treatment that somebody else has got, and then try to ask questions in that regard, right? And the example that I was trying to tell you was that my dad was diagnosed with cancer in 2020, right? And to begin with, it was right in the bang in the middle of pandemic, so it made things worse. But my dad would call up anybody who remotely had cancer without even trying to know what kind of cancer did the other person have, right? His point was that it's one word, and then it's just assumed that everything that they went through would probably right. And that's one of the very big concern that it exists. That almost two people going through a similar problem assumes that the solution will very similar, which may not be the case, right? That's primarily what also drives the reason that personalization is a key to healthcare, and that is why doctors play a very essential role. Right? They ensure that that personalization is delivered to the patient in the right manner. That's the primary key identifier there, right? The second thing that I've seen also is that a lot of people, even today, try to question the motive behind lot of care recommendations, right? What I mean by that is, let's say if I have a health issue and I go to a doctor, doctor tells me a bunch of tests, and in the back of my mind, I am trying to reason, oh, but why so many, right? I'm trying. See, you think from a doctor's perspective. He is thinking, okay, he might have A, B, C. I'll get these tests done so I can rule out the options, right? But from a patient point of view, because we are taught to be, let's say, skeptical, and so we tend to try to judge something that we don't have enough knowledge about, right? we have we've made these two as a very fundamental core aspects of the product right now, right? We want to encourage health literacy, and we want to encourage people to ask questions so that we can really enable them with the answers that they would like.
And so, if I understand the health literacy part of it, but when, let's say, if somebody wanted answers, how are these answers given? Because in today's day and age, all of us seem to go to Google to get our answers and WebMD to get our answers and things like that. So, how does Prodoc give the answers to questions that patients have, which is different from the classical thing of, oh, I have something, let me Google it, which is the equivalent of your dad calling up anybody and everybody who had cancer to say, hey, tell me what can happen with cancer. Because that's what Google will do. If you don't have enough details, it's going to throw up everything at you. And of course, we have the WebMDs and whatever equivalents of it that all consumers tend to go and, then start self-medicating, blah, blah, blah. I just want to understand, what does Prodoc do and how does it do it to help this aspect of patient care?
So this is also something so true, right? We all Google, right? We all a blink of an eye put everything, and very interestingly, right? Tried yesterday, a cousin of mine call call me thinking, because I'm in healthcare, he assumes that, oh, now I am as good as a doctor, so he's making this call to me, and he says that he's experiencing breathlessness, or not breathlessness. He says, I'm feeling congested to breathe. Could it be related to the cholesterol and the issue that I had last month? And I'm like, first of all, I'm not a doctor. Second, they don't sound like the same thing. He said, no, I just checked YouTube and it does say that it could be related. I said, yes, if the YouTube is saying that, please go to a hospital first, right, rather than Googling. But coming back to that point as to how we are making a difference, right? This is also what we have to understand, Sheetal, that there has been considerable amount of work that has gone in to address this specific problem, right? A lot of us are going on internet and reading things, and the accuracy of the information is highly questionable, right? As part of Prodoc, what we've done is we actually integrate with LLMs that are primarily designed for medical related.
Okay.
Right? This ensures that the answers that we are giving are at least not taken from the internet, or not with respect to they're coming from well researched sources, and they're not coming from any internet source, right? If you've heard of Google's MedPalm,
Yes.
it's again an LLM, and it's very specific to healthcare, and it does a fantastic job in replying to queries. The second thing that we have also done is we have ensured that we never recommend a care treatment to the patients through this platform, right? What we are trying to do is we're trying to answer the question. So you could, as a patient, I could go to Prodoc, and when I say Prodoc, again, we enable all of this on WhatsApp. So this is just a WhatsApp chat that you're having with somebody, right? So you could go to this number, and then you could just ask simple questions. For example, from panchakarma treatments to surgery related question, right? We're not saying you should have the surgery. What we are saying is what would this mean, right? If you are a mother in your first trimester, what is that you can experience, right? What is probable experience that people will have? If you have cough and cold, what is the probability that you should probably see a pulmonologist than to see a general physician? We're trying to help determine and educate, but we're still effectively trying to tell you that if you have a problem, you should see a right doctor to get that treatment rather than actually suggesting a treatment, right? We and this is a regulation that is being followed across the industry, that there are no care suggestions that are available on the platform. We are only trying to educate and inform as to why a certain care journey could take a certain, right? For example, if a doctor requests you to do a particular blood test, you could always put that blood test and say, "What is this blood test specifically for?" And then system will give you that information.
Okay. So it's really truly focused on healthcare awareness and information rather than anything prescriptive. That's what you're trying to do, right?
100%, 100%. And I think we are still far away from believing in AI to an extent where we could take care suggestions from it. Right? I
Okay.
think that would be incorrect.
Okay. And so when you talk about doing this, how does this ability to get this knowledge and the ability to get this information, how does that provide a more how does that improve the customer experience as far as healthcare is concerned? Because that's one of the things that you talk about.
100%. Right? So we've done two, three things. The one of the most fundamental thing that we have done is that we do not provide same set of information to everybody. Right? So we have removed the robots, the bots in the middle, and we're saying if you and I ask that same question, we would probably still get two different sets of answers, and I will tell you how. Right. So what we've done is we've said that one, the system is provided to the hospital. So the first thing that we do is we take the business related information and personalize the LLM journey based on that, right? So basically, what we're doing is first thing is let the hospital come back to us. So we take the business related information and build the know how as part of the AI. So now, to to simplify it, right? Basically, now the AI knows, oh, this is the hospital. I am an agent who's working for this hospital. This hospital has so many doctors. It has so much expertise. These are the services that are available. This is something that I know of. Right? That's the layer one. Second thing that we do is we take every patient and then we say, okay, there is a patient journey that patient is going through, right? So we identify what is that patient journey that patient is going through. So for in my dad's case, it could have been a biopsy report, right? And then a care treatment plan, right? So as a hospital, they can just upload that biopsy report, that care treatment plan, and once they upload that information, the system understands and then generates a curated plan as per the care recommendation that doctors give. Right? From a patient point of view, what is happening is at at multiple intervals, system intervenes and system tries to educate and inform the patient about where he is in the care journey and what he can expect. Again, a good example is in my dad's case, he had to go through, let's say, 30 radiology cycles. Right? At every week, a system like this would actually then come back and say, you finished the first week of radiology. This is what you can expect. You can expect these changes in the body. This is normal. This is not normal. Right? And as a family, we could ask questions which primarily we did, but we did that one day in a week to a doctor. And then if we had other questions, we would just bottle that up. We will keep it with us. We write it down and we wait for the next appointment, or we would call the hospital and then try to get to the doctor whenever he's free. The idea is to ensure that enough information is available to patient. One, you educate the patient so that they ask more intelligent questions when they interact with the doctor, right? And they try to understand. third thing is to actually provide the information in the language that the patient prefers. Right?
Right.
That's another thing. Right? And then primarily focus on care adherence. Right? Tell them when is the next appointment. Right? Help them book that appointment. Get to the right doctor. So the idea is to build enough engagement which improves care adherence, and it's scientifically proven that if you have right care adherence, automatically the outcomes improve. So that's the goal.
So, does this mean that typically the patients who come to you or get onto the Prodoc system are ones who are recommended by hospitals or from hospitals that you partnered with, or can any patient join the Prodoc system?
Today, we don't even have that option of a patient coming onto the. So again, let me take a step back, right? So Prodoc is a B2B platform.
Okay.
It's a platform that we offer to care providers that they can extend to their patients in the fashion that they believe would be most beneficial, right? So basically, it's the hospital using the platform to identify the right patients who will benefit from the care engagement and then bringing them onto a platform and then working with them.
That actually brings me to the next point, right? There is so much of healthcare data or patient data which will be sitting both with the hospital and with you. And today, everybody talks about, how healthcare and patient data is critical, and there is so much of security and privacy conversations around it, given that we're going into so much of digitization of healthcare. How do you ensure that the security and privacy of patient data is maintained? The regulatory standards are met with. We don't have too many in this country today. So just want to understand, how do you manage that aspect?
From our point of view, what we've done is from a Prodoc point of view to protect patient data, we've actually taken a more proactive approach. So what we've built the system itself is a HIPAA compliant architecture. So we already bring all the nuances, all the security protocols that are necessary, and they are compliant to a North American market. So they are following a very it's a matured law that was been in place for a while. Right? What we also do is we ensure data encryption both when the data is when we store the data as well as when the data is in transit. Right? So we ensure encryption at both sides. That also ensures that even if there is a data exchange that is happening, it's always secure. From a data security point of view, I can tell you that irrespective of how much we do, it's not enough. The only way to ensure data security is to continuously keep revisiting that security apparatus and keep improving, right? And at this point of time, that's what we do. We continuously ensure that we are revisiting this, at least the apparatus that's built inside.
And is the encryption based because of the utilization of WhatsApp, which is what your product is, utilizing, or is it over and above the WhatsApp encryptions?
WhatsApp provides a level of encryption once the data is made available as part of the WhatsApp's ecosystem, right? But there is a ecosystem that exists where Prodoc operates, which is outside the ambit of WhatsApp, right? So when I talk about data encryption, both transit as well as standstill data, I am talking about the ambit of where Prodoc exists, and we work with Google very closely to ensure that this happens. Right? The second part is where WhatsApp comes in and they ensure the transit of the data, right? However, there are a couple of very interesting things in the law right now. Right? It says the data has to be a fiduciary responsibility has to be with the person who is maintaining the whole digital apparatus. So we are in a way responsible for that. Second is that it should be utilized for the reason for what it was collected, right? Which is also very important, right? Because in our care, the primarily we are the data that we are collecting is something to build as a long-term memory, because we think that a digital care assistant would be pretty useless as a device if it does not remember what the history of the patient is, right? So we are continuously improving that. But what we also do is we never keep the data itself. We only keep the memorization of the data or summarization of the data with us, and then try to not keep the digital copies of the data itself. So
That's interesting. You also, on your website, talk about a health GPT solution. Given that the whole world right now is speaking Gen AI and GPTs, what is this health GPT solution that you're providing? Can you tell us?
so again, the part of that health GPT solution is what you see in the health, the primarily the Prodoc AI, which is the engagement platform, right? So health GPT is the AI apparatus that is available in the backend, and basically what we are doing is, instead of providing a, let's say, a universal platform like MedPalm, we create custom AIs for different care providers, right? For example, if there is a hospital A and they're providing, let's say, a multi-speciality kind of an information to their patients or providing that care to the patients, when they take Prodoc, we actually built a custom GPT kind of solution for them, which is available for the business. And of course, WhatsApp plays a small part in enabling us to deliver that information to the patient, right? What we also, um, let's say, the, again, the idea is that the generation part or the information that is generated as a response to a query is the job of the health GPT, you could say. And then the transfer of that information is what WhatsApp comes in.
Ah. So you also earlier mentioned that in the language of the consumer. So I let it slip then, but I'm going to come back to it. You said, the information needs to go into the language that the consumer wants. I just want to understand a little more. Is this many, many languages of India? Is this currently key languages? Do you also use AI for translation of information into these languages? How does that?
The ability to speak in the language of the customer has been one of the biggest bottlenecks for IT to penetrate in Indian market.
Correct.
Right? There are so many demographics, so many versions of the language itself, right? And it has been very difficult to do this when it comes to predefined solutions like apps, right? One of the reasons why we thought that app was a very bad idea to go with was primarily because we think that an app ecosystem has limitations with respect to personalization. And when you talk about personalization, it can be personalization in terms of care, it can be also personalization in terms of consumption of information, right? The mode of consumption itself. So what we do today is we actually have, let's say, we use the language in which the conversation is initiated from the patient side to identify the language and then respond back. And all of this is done through AI. Right? The place where it gets interesting is that this does not just enable us to support local languages, it also helps us to support languages which don't necessarily exist in the book, right? For example, a lot of us speak English, right? We type Hindi in English.
Right.
Amazingly, today we have AI ecosystem that understands that, can interpret that information, even respond in the same response. So that's really great. What we also have done is we've realized that, let's say, the LLMs that are available out there are still lacking in the ability to support all languages. So what we have done is we have cooked up our own secret sauce by bringing together two elements, language translation models and the LLMs. So now what we can do is we can use the LLMs to generate the right answer and then use the language translation models to actually get to the customer in the language that they prefer, right? And that kind of brings the best mix of both. Yeah.
Language is quite tricky, right? Especially when it comes to technical terms, when it comes to healthcare. Not everything can be translated. It's quite fascinating. I was having a conversation yesterday with somebody, and they said that there is no regional language equivalent of the term caregiver, right? Think about it. Not in Hindi, not in Gujarati, and I speak three languages, and I couldn't come up with the term. in a
Right.
regional language. What happens in your case where there is a lot of technical language, there's a lot of specific, if I may use the word jargon, which is health related? How does
Okay.
the whole translation piece work then?
Again, very interesting, right? You're right. A lot of technical information cannot be translated into regional languages. Either the words don't exist, or even if the word exists, they're so complex that both you and I will have challenges understanding them, right? In our case, one of the primary fundamental, let's say, designs that we have assumed to begin with is that the patient does not need technical information.
Mm.
There is no point in giving an information to patient in technical terms that you probably not be able to appreciate, right? So the LLMs are already programmed to give a much dumbed down information that can be interpreted and exchanged in a more direct way, right? The other thing that we are also doing is we are also trying to keep the information limited, right? In the sense, we're not trying to dump a large, and that's where the WhatsApp is an excellent mechanism, right? So you can't, if you give somebody a paragraph on WhatsApp, they'll probably not read it,
Needed.
right? My boss used to say, if you write me an email of more than 100 words, you can take it from me that I'm not going to read it, right? So that's the same thing in WhatsApp, right? If you write something more than 40 words, it probably will never be read, or unless it has like really great information. So what we're trying to do is, we understand that there is challenges in terms of language translation. Lot of work is already being done by Google and the OpenAI to actually support more and more languages, right? What LLMs are also smart enough to do is that they don't change the, you know, technical words, right? For example, if you say ICU, right?
Mm.
Even if you translate that information, it will probably come back to you as ICU. It wouldn't probably change to Hindi or Gujarati version of it. Right? So that's what is helping us at this point of time. I think the choice of the platform in which we are delivering the information and keeping the information constrained to the level which you and I can appreciate. These are the two things which are helping us to filter most of these technical data out of the discussion. Yeah.
This is so fascinating. I could ask you so many more questions, but I'm going to ask you the next interesting one, which is, where do you see the healthcare industry headed in the next 5 to 10 years, particularly when it comes to solutioning like the ones that you are doing?
Right now probably is the most exciting time to be in IT, right? Because the last 20, 30 years or last 4, 5 decades, if you could take that, right, have been probably culminating to this point where we could have fairly intelligent systems, right? Now, I think in the next 5 years, one of the biggest beneficiary of AI and the transformation that is happening today would be health education and building that health literacy part, right? That will definitely go a long way. There is second thing that I think which will also get severely impacted by this is the permutations and combinations that doctors have to do in their mind today to really get to the right solution. Lot of that probably would be done by AI, and it will become like a right assistant for a doctor, right? So the care assistance is going to grow multifold. I don't think it's very far that you would never have to listen to an IVR ever. You would never have to pick a one or a two or a language or a, you will never have to click a button, right?
Correct.
You could probably just call and you could make, you'd probably be able to make out that it's a robotic voice or it's like near human voice. But I can guarantee you that there would be no call waitings anymore, right? You will never be able to get to a place where you're waiting just to get an appointment. I think that appointment would be myth. Another interesting area that, and we have been working quite a bit in that area as well, is we're going to probably change the way the digitization itself is being looked upon. Today, if you look at a doctor who's actually trying to digitize your health records while you are there talking to him, right? His biggest problem is that he has been taught for 5 years to maintain an eye contact with the patient, make patient feel good, make patient feel connected to you, right? The patient has to trust in what you're suggesting. And at the same time, you should be able to type, right? And put that information somewhere, right? Honestly, this is an unreasonable expectation, if you would ask me, right? So when we actually presented our first clinic management software to a close customer, this is the first thing he said to us, right? He said, this software is going to give me back my, let's say, the eye contact with the patient, right? I'll give you a gist of where we are, what we're doing, right? Our clinic management software only has two options. It has a start button and a stop button. And it's primarily doing recordings. Right? So a doctor can go to a patient. The patient is inside the clinic. You can just say start, and then you can just have that conversation that you want to have with the patient. You can also write the entire prescription and give the prescription to the patient. Nothing changes. Once you're done, you can go back and just say stop. And when you stop, the AI will take the entire conversation and does the entire case sheet summarization, prescription, etc. Right? And we can do this in a lot of languages. Right? The idea again is that a digitization finally can come to a place where it does not change the human behavior. It helps the human behavior to continue to the way it was, and you would still see everything happening in the back end, right? I'll give you another example. I'm sorry, but
No, no,
I'll take
please.
another minute. The same thing on the other side, right? 85% of the appointment bookings across the world, I'm not saying about India, across the world still happen through phone call,
Correct.
which means every digital website, every app, every ecosystem that's built out there is still catering to 15% of the entire population. Now imagine in the next 5 years where a patient can just does not change anything for him. He can just call and he doesn't even have to tell the name of the doctor or anything. He can just call. And this you can do today on Prodoc, where you can just go and leave a voice note saying, I'm having a leg pain. Whom should I consult? And the AI would identify the right orthopedic in the hospital and come back to you with the name and number. Now, all we have to do in the next coming year is to make sure that this is available on voice. So you, I, and anybody else who would like it can call a hospital, just explain the problem, get the information of the right doctor, book an appointment, and be done with it, right? So I think that is the biggest change that will happen in the next 5 years. That nothing will change for the end consumers while everything will change in the back end. Yeah.
That's fascinating because we were just um, calling up a doctor for an appointment, and the appointment we got was for, I think, some 7th September or something like that. And we're like, we need the answers today, not wait for 7th September. It was quite bizarre, but that's fascinating to hear. Where do you see the future of Prodoc?
So at Prodoc, we've been through a 2.5 years of journey now. We think that we finally have a product market fit. We finally understand what a patient needs. We also finally understand what a doctor needs. Right? We are trying to balance that act and bring a solution that works. We are very focused on the India market right now, primarily because this is the most accessible market, and everything that we do, the impact is tenfold, right? Especially for the patient. Right? Me and my co-founder, we keep discussing this. And one thing that we have realized in 2.5 years is that any technology breakthrough in healthcare is irrelevant if it does not impact the patient or it does not benefit the patient directly. Right. So for Prodoc, the primarily focus in the next few years would be to actually become a trusted AI powered health assistant. Right. Something that sits on your phone, that is something available as a number or an app or a WhatsApp. The shape or form does not matter. The idea is that something that is there right next to you, available to you and me, and we should be able to primarily rely on this ecosystem to keep us healthy, right? There could be a lot of other elements whom we can bring together, right? Right now we are primarily focused on the care provider and the patient, but an insurer could be a great add to this whole overall ecosystem, because insurer is the one who is paying, right, at the end of the day, and they have enough incentive to participate in this whole ecosystem. So we are trying to see how we can grow the overall healthcare ecosystem. but if you ask me from a product point of view, the two things that we want to do, we want to first become a solution that is build delivering value to the patient, and at the same time helping this digitization of the overall ecosystem in a more seamless manner. That's our primary goal. Secondary, we actually want to go ahead and deliver the solution globally, right? While we think that the impact can be greater at this level, but entire southern hemisphere has the exact same problem that India has, and I think we can deliver the similar solution and impact much larger population there.
Raghu, this is absolutely fascinating with a growing aging population of this country, more than a younger population. Our demographics are definitely changing now. Uh, more power to you and more success to Prodoc in the future. I hope you do exceedingly well. And thank you once again for coming on to the Do Big podcast and sharing with us all that you're doing to change the game as far as patient care is concerned. Thank you so much for your time. It was an absolute pleasure chatting with you.
Thank you, Sheetal. Likewise, again, thank you for having me. Thank you, the Do Big podcast, for having us here.